So now we're going to talk about anxiety. Anxiety is a very common mental illness in Canadians and in the world. It basically covers this umbrella of disorders, including panic disorders, agoraphobia, social phobia, generalized anxiety disorder, obsessive compulsive disorders, post-traumatic stress disorder, or all types of anxiety. So in terms of anxiety disorder, anxiety is typically a complex combination of emotions accompanied by physical sensations. So if you experience a lot of anxiety, typically you're very worried, and that can lead to a lot of stress and physical sensations such as a rapid heart rate, nausea, chest pain, shortness of breath. You can also experience headaches and of course nervousness. Typically when you experience anxiety, you're overwhelmed with worry and fear, and they tend to be some of the most prevalent mental health disorders. They're typically chronic, they last at least 6 months, they're likely to get progressively worse without treatment, and so it's really important there again to seek help. Impairment in social, occupational, and or role functioning are most common. So if you're very anxious, typically you become more withdrawn and it becomes harder to go to work and see friends. Anxiety and depression usually go hand in hand, both in young children, but also older adults. The combination of depression and anxiety may increase both substance abuse and suicide. So of course the combination of both feeling worried but also being depressed increases the risk of self-harm. The lifetime risk for depression in people with anxiety disorders may be higher than 70%. So it really increases the risk of having depression if you experience a lot of anxiety. In Canada, 2.6% of Canadians over the age of 15 reported symptoms consistent with generalized anxiety disorder, so fairly common. The yearly prevalence for any anxiety disorder is over 12%, and 1 in 4 Canadians will have at least one anxiety disorder in their lifetime. So some of the most common mental health disorders we see in Canadians. About one third of those suffering from anxiety disorder receive treatment. So there again, there's problems with people getting help when they suffer from anxiety. In terms of screening, we often use the GAD-7 screening test for anxiety, and so it's basically looking at feelings over the last 2 weeks, and the scoring reflects basically how often you're experiencing those feelings. So anxiety disorders go from severe to moderate, or moderate to severe. Severe anxiety makes it almost impossible to act. So the person becomes so worried that they're unable to make decisions and move forward. Anxiety is out of proportion to the situation, so often those patients will fear extreme outcomes that are unlikely to occur. Fear of doing routine tasks like going to the supermarket or riding a bicycle or even getting in a car can be associated with anxiety. Generalized anxiety disorder is basically a persistent excessive anxiety and worry, always thinking about the what ifs. So what if, fear the worst in every situation. Worry is exaggerated, unrealistic, with nothing specific to provoke it. Everyday concerns such as work, health, or finances can cause marked discomfort and distress. So again, because the person is so worried, it becomes very difficult to make decisions. At least 3 of the following symptoms accompany the worry: restlessness, being fatigued, problems with concentration, irritability, muscle tension, and problems with sleep. Also significant impairment in important areas of functioning. And as I said before, typically this problem would last at least 6 months. It affects about 3% of the general population a given year. The lifetime prevalence is around 5%. Women, again, are more likely to have this problem. Individual has a hard time controlling the worry is basically the key symptom of generalized anxiety disorder. So what can we do to help prevent anxiety problems? One of the key things is to get help early. Like many health problems, getting help early usually makes treatments easier and improves the outcome. Another thing that's been shown to be really useful is to keep a journal. So it provides feedback in terms of what's working. It also helps keep things in perspective. People with a lot of anxiety tend to see the worst in all situations, so keeping a journal gives them feedback. Prioritizing is also really important, so making sure that you're managing your time and energy properly to do the things that are going to be most helpful in terms of controlling the anxiety is going to be really important. And of course, we want to avoid all unhealthy substance use. So a lot of people that experience a lot of anxiety will end up with addiction problems because they're trying to escape the worry with substance abuse. In terms of treatments, by far the most effective is talk therapy, psychological counseling. Typically, cognitive behavioral therapy is what is recommended. It is one of the most effective forms of psychotherapy for anxiety disorders. Generally, it works quite fast, and a short-term treatment will focus on teaching you specific skills to gradually return to the activities you've avoided because of the anxiety. And of course, the symptoms will improve as treatment goes on, and it will help to build on your initial success. Other things to do: keep physically active. Again, the release of endorphins after exercise will help to improve mood. You want to avoid alcohol and other sedatives. You want to cut back or completely quit smoking. You want to reduce coffee. Coffee is a stimulant, and that tends to make anxiety worse. You want to make sleep a priority, so getting proper rest is going to be extremely important for mood, and same with diet. A balanced, nutritious diet is going to be essential. Other treatments that have shown promise: Kava is probably the one that has the most promising research right now in terms of treating anxiety. We understand how it works. It works on the GABA receptors, which typically are the receptors that we target when we're trying to reduce anxiety. And there's several clinical studies that have shown that Kava is effective in terms of the treatment of anxiety. And of course, we want to be careful with Kava. It can be hard on the liver, so typically it's recommended that liver enzymes be checked at least every 3 months. In terms of dosage, the dose of Kava lactone, which is the active ingredient in Kava, what's typically recommended is 60 to 240 milligrams per day. And patients with depression, liver disease, Parkinson's disease should avoid using Kava, or at least discuss it with a health professional first. Another herb that has great research and good evidence in terms of treating anxiety is valerian. Valerian is a well-known sedative, so it helps to reduce stress. There's a number of studies that suggest that it does help promote better sleep, and has been reportedly used in people suffering from anxiety, and it was beneficial. So in terms of dosing, typically I recommend that patients use valerian tea, especially before bed if possible. And so the other option is to use a supplement. And when a supplement is used, typically the dosage will vary between 400 milligrams and 900 milligrams 2 hours before bed. Another potential natural treatment for anxiety is theanine. Theanine is the amino acid found in green tea. It increases the production of what's called alpha brainwaves, which is associated with feeling calmer. There's limited evidence as a treatment for anxiety, but because we understand the mechanism of action in terms of its impact on the alpha waves, theanine is an interesting option for those suffering from anxiety. Dosage is typically between 200 and 250 milligrams per dose.